We have Ashley Marola here today that will be talking with us about the STOP program. And just a reminder to subscribe to our YouTube channel, to like our videos and comment and keep up to date with things. If you have any questions, please drop them below and we'll be sure to get back to you as well. So just a little bit of information on Ashley. Ashley Marola is a licensed professional counselor who's been working in the field of mental health since 2007. She received her ACS, which is Approved Clinical Supervisor, in 2019. Ashley is currently the program manager of the STOP School Violence Program, and she also provides outpatient counseling services to adolescents and families. Ashley specializes in the field of crisis and trauma and has been trained in complex trauma, child and adolescent trauma, and modalities such as CBT, cognitive behavioral therapy, TFCBT, which is trauma-focused cognitive behavioral therapy, and EMDR, which is eye movement desensitization and reprocessing. So thanks so much for joining us, Ashley.
Thanks for having me.
So the first question that I think people may have is, what does STOP stand for? What does it mean? What do you do?
Yeah, some folks are like, oh, STOP's an actual acronym. So yeah, STOP stands for Students, Teachers, Officers Preventing School Violence. We sometimes like to argue, though, that the P should probably stand for parents, but STOP, yeah, that's what STOP stands for.
That's awesome. Okay. And then based on what you're telling me, do you work in conjunction with the prosecutor's office?
Yeah, so actually the Department of Justice, the DOJ, granted the Bergen County Prosecutor's Office with the STOP grant in 2018. We were subawarded the grant, so we've been working very closely with them since then, and it's really been a great experience.
Oh, that's fantastic. And this is the Bergen County Prosecutor's Office or statewide?
No, Bergen County Prosecutor's Office.
Awesome. Okay. I know that there are a few different iterations of the STOP grant. So what trainings are you currently offering and are currently available?
Yeah, so we technically have two STOP grants. So the first STOP grant that we were subawarded in 2018, that covers all of the basic foundational mental health trainings that we can provide to all of the schools in Bergen County. So that includes trainings like Youth Mental Health 101, the full Youth Mental Health First Aid, the 8-hour training through National Council. We could also provide mental health in schools, engaging students of concern training. And then we also offer, and those are all for staff. Any staff member within the schools are eligible to take those trainings. And then we also offer for students grades 6 through 12, the Say Something program that was created by the Sandy Hook Promise organization. The first grant actually ends in 2021, September 30th, 2021. So that's coming to an end soon. But we did get a second STOP grant in 2019, which primarily focuses on building assessment care teams. So we provide that training as well as mitigating the psychological impact of lockdown drills, because that was really a focus pre-COVID. We also offer mitigating the psychological impact of crisis. And recently we started providing a training for strengthening staff. And those are all for staff members of the school districts.
Oh, that's fantastic. And I know you were just telling us about the ACT training. Can you tell us a little bit more about that? And I think it has a consultation element too.
It does, yeah. So the building the assessment care team training is really an amazing opportunity for schools to take advantage of. And I do just kind of want to make a plug that all of the trainings that we're talking about today are completely free. Nothing is for a fee for any of the schools. So it's definitely beneficial for the schools. Yeah, so the building the ACT training comes with about an 1.5 to 2 hour training portion, which is a presentation that's really based on evidence-based research and recommendations made by the National Threat Assessment Center. And it talks really about the nitty-gritty stuff, like how do you even set up an assessment care team? What does your school want to call it? Who should be on the team? What do your policies and procedures look like? How do you engage the parents and students to really be an active part of how this team functions in your school? And even within that presentational training, we offer tabletop exercises. Everything's virtual now, so we'll still as you come some kind of scenario walkthroughs. We go over what risk assessments are available, what's out there, what works, what have been used in schools this whole time. And then we kind of talk about where the schools are, what they think they need, assistance with, what they want to implement. And that's where the consultation piece comes in. So with the training, everyone gets technical assistance and at least 3 to 4 consultations throughout the school year. Because this isn't a training, this isn't a training that you could just kind of give a one-time deal and say, good luck, right? I want to kind of go back in there and we talk with them. How's implementation? What have you guys tried? What's been challenging? What are some of your successes? Have you been dealing with particular families that maybe you want some support with, some resources for? We talk about all of those differences.
That's fantastic. I think you may have answered some of this, but what benefits do you see from the schools that are going through these trainings?
Yeah, I see a lot of benefits. I really do. And our schools of Bergen County, I mean, they're great. They're really doing such amazing work already, but it's really helpful that when we give them any type of training, information, resource in the spirit of prevention and early intervention, it really just kind of sets the tone for how they can better serve their students, right? And that's what kind of helps facilitate those healthier, stable relationships that's what our students need. That's what they look for, which is conducive to learning. It's conducive to them building, secure relationships in the rest of their life. That's what keeps our kids safe. Right. So when we talk to our students, we hear them when we meet them where they're at. That's really what kind of snowballs into these greater relationships and connections our schools will have with our students.
Yeah, that's fantastic. We've been hearing a little bit, from schools and in the news about this Handle with Care initiative. Can you tell us a little bit about that?
Yeah, it's a really great initiative. So Essex County, Newark particularly, and even a town in South Jersey, Middle Township, they've had this rolled out for quite some time. And this initiative is really based on the awareness that our community should have about the impact of the ACEs, our adverse childhood experiences, and really how that impacts our students. So the point of the initiative that will roll out for the entire state come December 31st of this year is that anytime a law enforcement officer enters the home of a student, whether it's for domestic violence purposes, substance use, whatever the case is, if they have contact with that student, they're then supposed to notify the school of that student the very next day. So say law enforcement's called to a home for domestic violence and there's a student there. The officer will then gather very basic information about the child, name, date of birth, the school they attend, and their grade, and they will give a Handle with Care form to that school the next morning. And this isn't to alert any specific action on the school's part. It's just for them to kind of be more aware and more knowledgeable that, hey, something happened last night. The student was in contact with law enforcement. Let's have an extra set of eyes on them today, right? Let's check in later on in the week. Let's see if they need breakfast. Simple, basic ways that we can literally handle that student with care.
Right. That's fantastic because as we know, so many things happen outside of school. And so for the school to have this mechanism where they can be made aware of things so they can, handle these students with care and be aware of adverse experiences happening, it's so important.
Yeah, absolutely. And, for those of us that know what the ACEs do and the impact they have on students later on in life, one of the biggest ways that we can combat the effects of ACEs is to build those secure and healthy relationships early on. And that's what this initiative is really supposed to kind of foster. The relationship between the students and the officers, the students and their point people at school, and really just kind of get everyone involved to give them as much support as we can.
Right, that's fantastic. And from what I hear in Essex County, they've been doing this, it's been having good results, right?
Yes, definitely. I actually spoke to the assistant principal that was working with the initiative down in Middle Township, and she was literally raving about the positivity that it just brought to the school. It just brought not that they weren't already like looking at their students and being aware of what their needs were, but it just gives you a different perspective of what could be going on in your student's life.
Right. Awesome. So this brings me to our last question, since we just started talking, about trauma. And of course, this is the BTTC channel. So we ask this question of everyone that comes to us. In your opinion, what allows someone to overcome a trauma history?
Yeah, that's a big question, but I fully believe that the one way that we could come over some of those trauma histories is through a multi-systems approach. I think it first starts with professionals like you and I in our community really acknowledging that trauma doesn't just affect us on a psychological or emotional level, but even deeper, right? Biologically, it affects us. So
Right.
until we can really treat every area that's potentially impacted by trauma, then we're really not treating the whole person. And by that, I mean, setting up really healthy, stable relationships in someone's personal life, connecting to a mental health provider or mental health resources in the community, a medical doctor, right? Getting physicals done every year, eating right, exercise, healthy doses of self-care, yoga, meditation, whatever healthy coping strategies work for that person, I think will really lead to treating the whole person totally. And that will only lead to healing and growth and really just bringing them through and moving them through and beyond their trauma history.
Oh, I love that answer. Yeah, it really is the whole, dimension of the person and thinking about all of those pieces.
Absolutely. And that only builds for a stronger and more resilient version of ourselves, right?
Absolutely. Well, Ashley, I guess the only other question I have, just to clarify, these trainings are for schools, right? So we can share, I'll share your email address below. I guess that's probably the best way for people to get in touch. And it would
Yep.
be a school reaching out for trainings versus an individual person.
Absolutely. It's any school in Bergen County, public, private, charter, what have you. And anyone from the school can absolutely reach out. Principals, school social workers. I've had nurses contact me. So really, it's available to anyone within the school, and then they would be able to help set up the trainings if they're interested in for the students as well.
Right. Awesome. Okay, cool. So I'll share all of that information. And Ashley, thank you so much for joining us today.
Thank you. I appreciate you having me. Have a great day.
You too.